case of removal of a plantar fibroma. So we're going to mark the skin incision. I'd like to mark where we're going to do a lazy S incision. We have to make the incision longer than the fibroma itself. This fibroma is about 1.2 by just over a centimeter. And these are very common in the plantar fascia, and sometimes we can get rid of them with things like verapamil topically, but when they're problematic, we remove them and send them for biopsy. Okay, so we're closing up. It's about close to 2 centimeter incision, so we do need to make the incision larger than the fibroma itself, and we'll take a look at what we removed in a moment. And then what we're going to do is a sterile dressing. Because it's a plantar incision, this will need to be offloaded. So we have our patient with a cast, boot, and then they'll be for about 3 weeks. We do a little longer for the plantar incisions, so we don't get a stretch on the incision and a possible gap or dehiscence. Specimen itself, we've got a small piece that we also took just to the right of the specimen jar that we'll put in there and send to pathology as well. Sometimes there's just little extension pieces. Now we do let the patient know that these can come back. They're notorious for growing back, but usually that'll take several years if that does happen. We like to do this procedure as opposed to removing the whole fascia, medial band, because that's a much more invasive and changes the arch structure of the foot.